I don't think I've ever had a patient that didn't want to be good for me as their doctor, because
Yes.
we innately, that's what we want, to be liked, we want to be appreciated. And, you know, I don't I don't ever think that I've thought my patient lied to me. I think that I always see it as that my patients want me to see them as being a good patient, right?
Yeah.
And for me, I I don't have good or bad patients.
Mm.
To me, I
But it
just
can be
have
very
people that I
overwhelming
need to help.
as a
Yeah,
patient to be
yeah,
told to do a whole lot of things. So this is such a perfect intervention, really, in between patient and doctor.
yes, because today we have 47% of people are living with a chronic disease. So
Mm.
whether your doctor has started you on a tablet or not, you have a chronic condition. If the doctor said to you, let's try diet and exercise first and see if it works, they diagnosed you as early stage. And chronic diseases are insidious and they're progressive, which means that you're acclimating to them without even realizing. And on top of that, we now have 30% of people have 3 or more chronic conditions.
My guest today is Dr. Jenny Wellington, founder and CEO of Annuo Medical Technology Solutions. Dr. Wellington is a graduate of the Royal College of Surgeons in Ireland and has 13 years' experience in clinical, medico-legal and digital health. Over her years of working on the front line of healthcare delivery, Jenny noticed an increasingly overburdened healthcare system, which is negatively impacting patients. She knew there had to be a better way to ensure the 47% of Australians living with chronic disease get the treatment they need and deserve. So she created Annuo, Australia's first medical networking platform. Annuo is designed to better engage healthcare consumers in their path and healthcare journey to develop an ecosystem of healthcare professionals aligned with their healthcare values. During her 13-year medical career, Jenny has held leadership positions, including as the Registrar Representative for Psychiatry. Jenny is currently on the Outreach Committee for the Balance Society of Australia and New Zealand. Outside of her medical work, Jenny has a passion for fostering equal opportunities for women and girls eager to pursue careers in STEM. Welcome to Hacking Health. This podcast is for future-focused health experts, thought leaders and change makers who are interested in making health accessible for everyone, because together we can get to the future faster. Jenny, if you could throw caution to the wind and take a risk, what would you do?
If I could throw caution to the wind and take a risk, I don't do that. I'm a scientist. I believe in statistics, and I just don't. It's not something that I do. But I will say, starting Annuo was the biggest risk.
Of course.
Because the only statistics that I had available to me when I was founding Annuo were the ones that everybody has access to in terms of funding. What was buried and what I didn't really see was the statistics about funding that goes to Black female founders, which
Right.
is 0.003% of any funding in the world goes to Black female founders. And I think it was in 2022, Christmas of 2022, I looked up an article that only 97 Black female founders in the world had ever raised over $1 million in funding. And that would have been after 2 years of bootstrapping. And by that point, I was a year and 14 months in.
Oh my goodness.
So for someone who doesn't take risks,
it's a pretty big risk. I actually heard a
that's a big
podcast
risk.
about a VC who was a woman of colour, and that was her whole platform to fund more diverse startups, because those statistics are just horrendous.
Yeah, they absolutely are. And I'm living proof of that. So I have literally bootstrapped Annuo. I worked 3 jobs at one point in time to be able to look after myself, my kids, my responsibilities, as well as fund the entire development. And I have emails of 159 no's. And I persevered. And today we have over 140 clinics under contract.
Amazing.
3.5 million subscribers.
5 million. And is that globally?
No, 3.5 million. That's Australia only. That's not even when we expand.
Oh my
That's just in Australia.
goodness. That is massive considering what our population is.
To my knowledge and to my marketing analysis, no health tech company or health had ever had up to 5%. And we have 3.5 million subscribers under contract in a country with 26 million people. So,
oh my gosh. Oh my goodness. So my next question sort of seems a bit pathetic now, but do you prefer Ireland or Australia? Because you're Irish, and also can you share why? But I think in talking to you, your accent is such an international sounding accent. I've seen a few little Irish quirks in your accent, but talk to me about that.
Yeah, so talking to you a little bit about my Irish accent. So I actually had to water it down when I came over to Australia because I remember I saw someone else like, oh my God, your baby's such a cute little mite. And then she was just like, did you just call my baby a dust mite? And I'm like, no, I didn't call your baby a dust mite. And I was like, oh, you're one down the road. And they're like, the one down the road, what does that mean? So there's been a whole bit in how I've learned how to speak from coming here, but that's natural. I think anybody who comes from anywhere will tell you that there's a lot of like slang and colloquialisms that you drop. But I would say that Ireland will always have my heart because that's where those are my formative years. That's where I spent my formative years. But Australia's home. Australia has given me so much, and there was no better evidence of that than when I went to London recently. And I remember at one point I was like, oh, can't wait to get home. And then I realized Australia really is home.
Oh, that's nice. It's a switch.
Yeah.
Are your parents in Ireland still?
No, they're not. So my family have quite an interesting history with Ireland. So both my parents are mixed heritage. So my father has Scottish heritage as well as Nigerian heritage. My mother has Afro-Caribbean heritage as well. And during the Civil War in Nigeria, my grandparents were very close to the SMA Irish nuns and priests that were in Nigeria at the time doing a lot of missionary work. And in an effort to quash the rebellion, the Nigerian government told them that the Irish nuns and the pastoral team had less than a week to get out of the country, and they had no way to leave. So my grandfather's best friend was actually in the military, and he was able to arrange for them to get a plane off to Sao Tome. And from Sao Tome, they flew out to Ireland. And the priests and nuns were really grateful. And they always said to my grandparents, keep in touch, make sure you write. And my grandparents are very good at writing letters. So as the Civil War progressed and they started to conscript a lot of the young boys as soldiers, my grandparents had 8 children. They had 5 sons and 3 daughters. And they were really worried because my uncles are getting really tall. It's hard to hide them in a dress. And so they wrote to the priests and the nuns and they said, we'll do the same thing, put them on the plane, send them out to us. And they did that. And then they enrolled them in school. So my mom's family all went to school in Ireland. And some of them went to university. One of my uncles is an Oxford Law graduate. My other uncle went to the College of Surgeons, just like I did. My other uncle went to Trinity College and he went into software engineering. He's a really great mentor. And so when it came time for me to go to school, again, my grandmother wrote a letter, the same to Father Byrne again. And Father Byrne was like, yep, I don't think Rathdown, which is where my aunts went, had space. But he was like, oh, I know this lovely school in Galway called Calmore Abbey. And they're Benedictine nuns, different denomination. But they'll take her. And then that's how I ended up in Ireland. So I went to boarding school in Ireland and then went to university in Ireland. So my formative years are spent in Ireland.
Wow. What an international story. Not what I was expecting. But great. Great to
Yeah.
understand, how you came to be here, which is such a cool story. So, who is one of your biggest mentors or inspirations in business?
In business, I would have to say Pauline Fatawi, who's now a director of the Australian Computer Society. And we met at a diversity in the entrepreneurial ecosystem event that Advanced Queensland ran. And she's such a warm personality that I was in the middle of speaking to someone and we just looked at each other and she just walked right up to me. And she said, "What do you do?" And I shyly told her what my startup was about. She goes, "You should be proud of yourself." And then she pointed at River City Labs. She's like, "Why haven't you come to talk to me yet?" And I was like, "Oh," I was like, "Oh, you guys are really, like you guys are really big." And she goes, "Yeah, I get that a lot, but talk to me. And you should ask me for stuff." And she goes, "You should have asked to come to talk to me." And then she said, "Do you have your phone?" And I said, "Yes." And then she said, "Tell me your LinkedIn." And I did. And then she put her,
Number in.
she connected with me right there and then. And she said, "I'm going to call you for a meeting." And then she looked at me and she goes, "Don't worry." And I hadn't said anything to her. She goes, "Don't worry. I'm going to help you raise money." She goes, "I have been where you've been." She goes, "I have seen people where you are." And she said, "It's going to be hard. You're going to need to have thick skin." But she goes, "We're going to get there." And that was it. And from then on, she just became my phone a friend. And she has been one of the biggest advocates for me in rooms that I didn't know that existed, helped me knock on doors that I couldn't even see. And so to have her with me on Friday was just like an amazing, amazing experience. And now she's one of the directors of the Australian Computer Society and River City Labs. So just been amazing just to have somebody that just gets it, that somebody that just acknowledges and understands everything that I'm going through and, just helps me and shapes me. And it's not all about support and telling me how wonderful I am. Like she's very honest and direct with her feedback, but you need that. You need someone who's going to see everything from all angles, someone who's going to tell you how you need to be better. And as a founder, then your duty to your mentor is to be coachable and to actually listen what you're being told, even if it hurts, even if it's somebody's telling you how ugly your baby is, which is your product, or
Yes.
what you're founding. You have to be willing to listen. You have to be open. And she has been amazing in terms of that, always challenging me. But more so than just business, she's always made sure that I'm okay, that I'm okay. Like on difficult days, she'll let me cry. And she'll say, "No, you need to let it all out, let it all out." And she's just like, "And tomorrow we'll start again." So he's been that for me. So I haven't had to put on the face or the brave face with her. It's just been true mentorship. And learning from her, listening to her, I've been able to put a lot of the things that she's put into place. But even lots of other people who have just given me little bits of their time. The Advanced Queensland Female Founders team have just been phenomenal. They have been such a driving force in terms of constantly putting me forward for things and really seeing me and seeing what value that my company can actually bring to the ecosystem, taking the time to talk to me. They're not just, the government. Like anytime I've had difficulty, I have been able to pick up the phone and sit down with them and have a conversation
Yes.
and get real advice, things that I can actually put into action. And they're very good at listening. They're very good at listening to what is happening. And they are truly invested in making it a much better place for women to actually be in that entrepreneurial space.
So you mentioned Friday night. What happened on Friday?
So on Friday night, I still have problems saying this out loud. On Friday night, I was the recipient of the Future Focused Business Achiever Award from the Women in Tech. And the theme this year was "We Are the Change." That alone resonates with me because I'm a doer. So I always believe that you should be the change that you want to see. And so to have an organization like that recognize what we're trying to achieve in our tiny little company was just phenomenal. And I'm still in shock.
Show us the award. Pick it up. If you're listening on the podcast, you can't see this, but it's a beautiful glass piece that says Women in Technology Awards 2023. Dr. Jenny Wellington. Amazing.
Absolutely.
Well
Just
done.
phenomenal.
Well done.
You know, I almost wasn't going to be there because I actually got nominated by someone. And when I saw the nomination come through, I didn't take it seriously.
Oh my goodness.
I thought it was a joke. And then a week to the submissions, the person actually contacted me and said, I sent you through this nomination. Like, you know, have you filled this out? You need to take this seriously. Call me. And so I called her and she said, you need to take this seriously. You know, like you need to apply for this. And I was like, and I really respect her because she was actually the pioneer winner of that award. So to have somebody like that nominate me, going through the whole process, I did it for her out of respect for her because I respect her opinion and I listened to her advice. But the other thing was giving the people for whom Annuo exists for, people that live with chronic disease, actually bringing the difficulties that they're having front and center, and giving a platform like that for understanding really was part of it, on top of all the other different soapboxes that I stand on every now and then.
Well, that's definitely the purpose of the organisation. I guess, what I understand of Annuo is the desire is to better treat patients with chronic disease. So have you been able to witness the impact that the technology has made, and maybe explain to us how it works and what's it like seeing your vision come to life and be so successful?
Annuo is a healthcare networking platform that allows healthcare providers to better communicate with their patients, but also the healthcare providers that share a common patient. And it helps them collaborate better over treatment planning. But more than that, it actually helps the healthcare providers understand where the patients are coming from and gives them a deeper understanding of what happens when they leave the consult room. It helps them understand what the healthcare values are of the patient. It helps them be truly collaborative and including the patient's voice in the care. And for the patients, what we hope that the platform does is that it provides information that is meaningful to people in a way that they truly understand and in a way that's impactful in terms of them being able to understand why the recommendations have been made and turning that understanding then into them being better equipped to put into action a lot of those treatment tasks. And it doesn't just create a block or document treatment plan. It actually kicks it off into action. So when you initiate it, it will send off referrals that need to get sent off. It will remind you to take medications. It will remind you to do the blood tests. It will always remind you to fast the blood tests as well and tell you when you need to get there to get the bloods done. It will ping to your doctor that you've got them done, so the doctor knows to look out for those blood tests. And if the doctor has suggested that you do things like blood diaries or pain diaries or, do any vitals like your heart rate and blood pressure, rather than bringing all those things down on a piece of paper or on lots of different apps, all of that is directly plugged into Annuo so that when you're sitting down in front of your doctor, it's not a memory task of trying to recollect everything. It's right there. And the data has been analyzed so the doctor knows on what day and how the treatment was influenced by lots of different factors. And that means that rather than spending time writing on lots of different pieces of paper or looking for different documents, your doctor just focuses on you and just talks to you about what you need and hears what you think and what you're feeling. And hopefully, over time, we hope that Anio will be that avenue that will actually really help the medical world understand, well, do these treatments actually work? What is really working for patients, especially now that a lot of medical research that we had always relied on, such as the STAR-D trial. I don't know if you ever heard of this. So the STAR-D trial was something that the psychiatry world has heavily relied on in terms of reliability of antidepressants to treat depression. And the study was supposed to include a specific assessment test being administered to determine depression, but also the progression of the disease and also the remission of the disease. And it reported that there was about 63% remission of depression with antidepressants. But now, with transparency, they've been able to find that the same assessment test was not used throughout.
Right.
And so there were people that were written into the test as having depression that on the scale of it naturally meets the criteria for depression. So as they took the medication, it was easy to report them as being in remission and the antidepressant worked. When in actual fact, if you looked at the standardized testing, they did not meet that criteria to begin with. So the raw data actually shows that it was less than a third of the people that antidepressants actually helped, not over 63%. And now the entire medical world is spinning on its head, thinking about all the time that we've lost in terms of honing in on something and saying this was it, when we should have been looking for other treatments.
Yeah, wow.
And so Anio has that potential to ensure that transparency is there from day one.
And it also has
really show what works.
The transparency maybe of like making sure that patients know what they're meant to be doing, because with chronic disease, it can be so complex, I suppose. If you've got all those things you're saying that you need to do, what if you miss one of those things and you're part of a trial and you just lie to say, well, I definitely did that. And so like, how can you get accurate data as someone who's such a data person if people aren't doing what they're supposed to be doing?
Exactly. And, the thing about it is that I don't think I've ever had a patient that didn't want to be good for me as their doctor, because we innately, that's what we want, to be liked. We want to be appreciated. And, I don't ever think that I've thought my patient lied to me. I think that I always see it as that my patients want me to see them as being a good patient, right?
Yeah.
And for me, I don't have good or bad patients. To me,
but it can be very overwhelming
that I need to help
as a patient to be told to do a whole lot of things. So this is such a perfect intervention, really, in between patient and doctor.
Yes, because today we have 47% of people are living with a chronic disease. So whether your doctor has started you on a tablet or not, you have a chronic condition. If the doctor said to you, let's try diet and exercise first and see if it works, they diagnosed you as early stage. And chronic diseases are insidious and they're progressive, which means that you're acclimating to them without even realizing. And on top of that, we now have 30% of people have 3 or more chronic conditions.
Crazy.
So if you think about the fact that for each chronic condition, you will see at least 3 healthcare providers. You probably see your GP, you probably see the pharmacist, you might see a specialist. Psychologist or whoever, and you have 3 conditions, you have over 9 people involved in your care. And we put the burden on the patient to be the carrier pigeon.
Yeah.
In terms of carrying the messages across from all these different people.
So true.
Right? When they're the ones that are carrying the condition, they're the ones that should be cared for.
Yes.
We should be caring for them. We shouldn't be giving the burden to them to carry that information and interpret and be the gatekeepers of, well, what should this person know? What shouldn't they know? right? And we put that on them. And people that have chronic conditions, they don't want to feel like a victim. They don't want to have that sick role. Nobody feels comfortable feeling that, I'm now in a sick role. I'm not who I was. They want to have the same quality of life as everybody else. And so when you put them in that position, they often report feeling like their chronic condition is a full-time job. And now I have this, I can't do this, I can't do this, I can't do that. They're then responsible for scheduling all the appointments. They're responsible for making sure that the information gets from Dr. A to Dr. B. They're also responsible then for making sure that their blood tests are done. They're also responsible for making sure that, that they get there on time, or that the referrals are done, or,
taking medication
for them to carry.
Yeah.
And if you think about, parents running around, working hard, trying to just be parents. And then you think about maybe one of them has a chronic condition or 3 chronic conditions, trying to look after their family and do that. It's quite demoralizing.
So have you talked to patients about their experience with the software?
Oh, yes. Before Annuo became a thing, I like to think about it, before it became a real thing, one of the very first things that I did was, when I conceptualized it, I built a very small version of it, and a GP that I know let me use it in their practice. And I just talked to the people that were using it for about 9 months. And that information was then turned into what Annuo is now. And I took it back to doctors and I said, well, this is what patients have said. Would you have a product like Annuo? And they're like, oh my goodness, yes, I want something like that. And then I realized that I would have to make a separate product for each different medical specialty, which didn't make sense.
No.
Because like I said, 30% of people have 3 or more chronic
you want
conditions.
them to collaborate.
Yes, these applications would have to talk to each other. And so it just made sense then to make Annuo agnostic. So at every single point in terms of the development, we have had patients, we've had doctors, we had every single stakeholder in medicine talking to us and telling us what they think. So medicine has to be people-centered. It's not just the providers and the patients, it's also the payers. So Medicare funding, what does Medicare need from us? What are their hopes and dreams for the system? And the policymakers. So the policymakers meaning, clinical guidelines that are being written, hospital administration, the healthcare facilities, what do they need to make sure that patients get what they need? And so, yes, we've listened to what the patients need, but in order to make it work for the patients, we have to get everybody in the ecosystem to be working together, and that's hard.
Yes,
and
it's hard.
So
oh my gosh.
you have to meet everybody's need.
Yes.
You have to understand what they need for that to work.
Yes.
And you have to bring that and implement that. And that really is the magic of Annuo, is that we've not just had patients giving us feedback, because that's what everybody thought at first. That's why we have over 350,000 health apps in the country at the moment. And chronic disease has still risen by 12% in the last 7 years, right? They are making an impact, but it's not enough to stop the bleeding. The magic sauce, I think, is making sure that everybody was involved in
the collaboration
of this.
Yeah, which is incredible, because the time that it takes, and you're talking about government departments and busy doctors, patients who have other things in their lives. So you've done an amazing job, and you're still young, Annuo, the business is. Are there any challenges that you are facing still being in the startup phase?
Oh yeah, just that, oh, you're young, you're a startup,
not taking you seriously.
Not really being taken seriously. I think that has been a challenge. It's been quite a significant challenge, in that you have no power when you walk in the room.
But I feel like the numbers that you were talking about earlier in the episode really speak for themselves in terms of people should be taking you seriously.
Well, now that we've done the work, and I had never said out loud until today in a LinkedIn post when I said, listen, This is how many people we've got now. Now, are you going to take us seriously?
Yeah.
Are you going to listen to us? Are you going to, are you going to now? I think, I hope now people will take us seriously. I certainly know that I went to Canberra and I had the privilege of being a panel speaker, but also facilitating roundtable discussions for federal government health, as well as state health in ACT. And what came off of that was I got an invitation to be part of the FIRE Spark Accelerator, which is the federal government's working group for the implementation of the national strategies for the implementation of the digital health.
Incredible.
And so, on a level, I mean, there's no badge or title that comes with that. But the fact that Anu is now in the room,
yes,
and we are now part of that
conversation. Yeah.
I hope that I'm able to now bring that to a much larger platform and be able to make that top-down impact that we had not been able to make when we were tiny little Anu that's just over 2 years old.
Oh my goodness. I've been so excited to talk to you today. I know because you're a startup founder, you've got back-to-back appointments and they're already bugging you for your next one. So thank you so much for talking to me today. And I wish you so much luck. I'm going to follow your journey with so much excitement.
Thank you so much for having us. Like it's been an absolute pleasure to talk to you. And every time I say it, I pinch myself. I still pinch myself that this is where we are and this is what we're doing. So thank you very much for listening to our journey and yeah, getting our message out there.
We're going to keep the conversation going in our private Facebook group, You Legal for Doctors. You're welcome to join us there.